this is a camera and this is a scope. Even the 4mm thickness scope has become a 1.8mm thickness scope. In this way, it is an excellent diagnostic tool and also a therapeutic tool to a certain extent. So this way, I don't have to put you through a lot of cumbersome investigations or any anesthesia inside an operation theatre. Hello everyone, I am Dr. Gopinath Duraiswamy, Clinical Lead Senior Consultant Orthopedic Surgeon from Chennai. Today we are going to look into a groundbreaking technology of the recent past, NanoNeedle Scope. As you can see, what I am having in my hand might look like a needle, but will you believe that if I say this camera? Yes, this is a camera and this is a scope. Okay, so what is it used for? In the early days, since the last 2 decades, we were doing keyhole surgery in the field of orthopedics to treat all intra-articular injuries. So be it an intra-articular injury, ligament injuries in shoulder, knee, ankle or wrist, elbow, wherever 2 bones unite we call it a joint, and wherever where's the joint, the joint requires some stability by the ligaments, and if at all there's a sports injury causing instability because of the ligament injuries, we need to treat it by a small keyhole procedure. As an evolution, we are using a 4mm thickness arthroscope to get inside a joint. Eventually, till date, it is a state-of-the-art and a gold standard treatment for all ligament injuries, but because of this groundbreaking technology, even the 4mm thickness scope has become a 1.8mm thickness scope. That means what a small scar injury or a keyhole surgery, it has become a nanoscopic surgery. So today we are going to look into the advantage of this nanoscopic surgery. So this has been the first of its kind available in India, and not much of surgeons does have it in India. So the advantage of the scope is it's just very small and sleeky. It is just a thickness, it's just the size of a small injection needle. So you won't even feel the prick of the pain as if you're going for a surgery. Just a small prick can get this camera inside your knee joint or shoulder joint or whichever joint you want to visualize, and this is going to take the feed of what's happening inside the joint and feed me to a small laptop, giving me a complete picture of the pathologies or the injuries, the knee joint or a shoulder joint or whichever joint I'm showing it to me. So in this way, it is an excellent diagnostic tool and also a therapeutic tool to a certain extent. So coming to just a demonstration in a bone saw model, all I have to do is just remove the cap and activate the camera, and if you can see this, it's just a small pointed injection needle and a camera is embedded inside the needle. Imagine this is your knee joint. All I just have to do is just pierce it inside the knee joint, and once it enters inside the knee joint, it's going to take the complete feed of what's happening inside the knee joint and relay it to a computer or a laptop in front of me. So this way, I don't have to put you through a lot of cumbersome investigations or any anesthesia inside an operation theatre. All you just have to is walk to my OPD and get a consultation done. If at all you need a nanoscope tip done, or if your complaints needs or necessitates me to investigate a knee joint or a joint which is troublesome for you to look into it, all I just have to do is a small local anesthesia inside the knee joint and just show in my needle which is having the camera and find out the root cause of the pain. So this is about the NanoNeedle Scope. So coming to the advantage of NanoNeedle Scope, it is a minimal invasive procedure where it will diagnose with precision, and also at the same time, if at all, if anything can be treated at the same time, it also can be treated with a minimal scar. And moreover, it's pain-free and the patients can return back to normalcy in the same day. And you don't require an admission most often, or sometimes some procedure might also require a day care procedure where a day's admission might be necessary. The next advantage is it is very so minimal invasive. You won't even be able to take a suture or a bite to close the scar which is the nanoscope made. That means it is a scar-free surgery or procedure. The other advantage of this nanoscope is since it is diagnosing you on the field inside my OPD on the same day. Once we can treat the condition inside OPD, it gives you a faster recovery, you get back to normal routine easily. And next is, since it does not require any admission, it cuts down the total hospitalization cost for the patient. And next important thing of nanoscope is, and I have found in my practice, it's even more useful for any sports persons, because elite sports athletes might be on their track of winning the sportsmanship or their tournament. Sometimes they too end up in any intra-articular injuries. So an admission can cost their progress in the tournament. So these sort of nanoscopes has allowed us to do daycare procedure for such injured athletes and put them back on track as early as possible, so that they don't miss their tournament or the next chance to winning the next field. Thank you.